Antimicrobial prophylaxis for children with vesicoureteral reflux. Definition: VUR is an abdominal backward movement of urine from the bladder into the ureters or caused by an anatomic and functional disorder. Antibiotic prophylaxis refers to, for humans, the prevention of infection complications using antimicrobial therapy, most commonly antibiotics. It is the most commonly used prior to dental or medical surgery. However, may be used in other cases, such prior to sexual intercourse for patients who suffer from recurrent urinary tract infection.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today. The workhorses of the urinary system are the kidneys, which are the twin bean-shaped organs in your body that clear harmful substances by filtering your blood. They're like a water purification plant that helps clean the drinking water for a city. They also regulate blood pH, volume, pressure, osmolality, as well as produce hormones. The kidneys are located between the T12 and L3 vertebrae, and they're partially protected by ribs 11 and 12, which are the floating ribs. The kidneys are roughly the size of a fist and are retroperitoneal, meaning they sit behind the peritoneal membrane, alongside the vertebral column. The right kidney is pushed down by the liver, so it sits slightly lower than the left kidney. In the middle of each kidney, there's an indentation that forms the renal hilum. Tubular capillary angle so that when the
Application in medicine. Children with febrile urinary tract infection commonly have vesicoureteral reflux because trial results have been limited and inconsistent. The use of antimicrobial prophylaxis to prevent recurrences in children with reflux remains controversial.
Vesicoureteral reflux is a condition where urine is found to flow backwards from the bladder to the kidneys. This abnormal backflow of urine can cause patients to have urine infections that affect the kidney, and in more severe cases, patients can have kidney damage as a result of a urine infection with the reflux. Children are usually diagnosed due to having a urinary tract infection with fevers. However, some children are diagnosed due to having a condition called prenatal hydronephrosis, where the child's kidney is found to be dilated on prenatal ultrasound.
Pros and cons. Recurrent urinary tract infection developed in 39 of 302 children who received prophylaxis as compared with 72 of 305 children who received placebo. Prophylaxis reduced the risk of recurrence by 50%, was particularly effective in children whose index infection was febrile and in those with bacilline bladder and bowel dysfunction. The occurrence of renal scarring did not differ significantly between the prophylaxis and placebo groups.
Welcome to this educational program. This module discusses vesicoureteral reflux, or VUR. This information is taken from a recent review of urination, the bladder, which is mostly health problems. While urine in the bladder is normally sterile, the air preeclampsia, a condition of dangerously high blood pressure, pylona, for easy urination. Ultrasound and nuclear bladder to see if kidney function and to see urine reflux is part of a combination of measures to prevent lower the to create blood pressure and periodic of the problem.
Issue applied to Ecuador. Antimicrobial prophylaxis, the prolonged antibiotic therapy increased the likelihood of bacterial resistance or emergence of adverse effects associated with the medication. This being a bigger problem in underdeveloped countries as Ecuador, where there is no antibiotics control leading to their misuse. Conclusion: among children with vesicoureteral reflux after urinary tract infection, antimicrobial prophylaxis was associated with a substantially reduced risk of recurrence, but not of renal scarring.